Hi, this is your Houston chiropractor, Dr. Gregory Johnson. This is your South Carolina chiropractor new team ring dinger member, Dr. Wes Richrdsson, and he's from Duncan, South Carolina, which is in between Spartanburg and Greenville.
Mm-hmm.
And this is day 2 of advanced chiropractic seminars, and yesterday and today we're going to be going over, and we have gone over already, detailed medical histories and examinations, orthopedic neurological examinations, indications and contraindications to doing the ring dinger adjustment. And I'm just going to clarify this right now. The indications for doing the manual spinal neural decompression adjustment on the y-axis are vertebral subluxation complexes of the spine and pelvis, herniated disc, bulged disc, degenerative disc disease, scoliosis, pretty much any spine-related condition, with the exception of those things like fractures and pathology, meaning cancer, tumors, metastasis to the bone, Arnold-Chiari malformations of the foramen magnum, and unstable post-surgical spines that aren't fused solidly or the screws are loose in there, which we recommend all the team ring dinger docs do a thorough history and examination and look at patients' diagnostics before they ever even do this technique on people. So, Wes, what would you share with our YouTube audience about your seminars yesterday and what you learned yesterday here at this seminar?
I learned quite a bit, like Dr. Johnson said, when to do, which is quite often the ring dinger, and when not to do, what to look for, what to ask people in their case history on when not to adjust like this, and just how to treat people. I've learned a lot. It's really pretty difficult to concisely say everything that I've learned. It's been a lot, very thorough.
And also, one of the other main contraindications of doing this technique are patients that have atherosclerotic changes in their vasculature, meaning buildup of plaquing in the artery walls, which could break loose and create a stroke. So we don't do these procedures on patients who have atherosclerosis or have had stents or heart attacks due to atherosclerotic changes. But if you're walking and living and breathing and moving in gravity, you can benefit from this. That's the indication, really, is if you're living, breathing, and moving in gravity, you can benefit from this y-axis adjustment, which we call the ring dinger. So we're going to do each other's adjustments this morning, and we're only going to do the y-axis adjustment on each other this morning and go through the rest of the day. In fact, many patients prefer just getting the y-axis decompression without all the side twisty lumbar rolls. In fact, in our seminars, we teach chiropractors to not do that lumbar side posture roll when doing this ring dinger. We had a couple come in from Wisconsin yesterday that saw one of our team ring dinger docs up there, and he did lumbar rolls on them and wanted to see them every day for a week, and then 3 times a week for months, and then 2 times a week for more months, selling them heel lifts and those kinds of things. We are teaching all the doctors that come here to get certified in the ring dinger technique that they don't need to build up the patient's case value or dollars with all these things like heel lifts and supports and other things that aren't really associated with the true purpose of the chiropractic practice, which in my opinion has always been the chiropractic adjustment.
Mm-hmm.
And that's the way I learned it at Palmer. What did you guys learn at Sherman?
We learned the same thing, that it's the job of the chiropractor, us to adjust the people, to adjust the patients, get out of the way and let the bodies do the healing.
Yes.
We put the bones where they need to be if they're subluxated, and then after that, we let their bodies do the healing.
Right. So, one of the things about the old model of vertebral subluxation used to be, bone out of place, crushing a nerve. Well, they now know that's not really a valid neurological and biomechanical sequel to each other. The new model of the vertebral subluxation complex neurophysiological changes is all about neuroplasticity and how the brain is constantly adapting to its internal environment, which includes the biomechanics of your spine. So what we do when we adjust patients with this, we stimulate every single joint in the spine and pelvis as well as the extremities so that we get a massive neuroproprioceptive bombardment into the cerebellum, which then the cerebellum analyzes that information and starts the process of neuroplasticity by re-engaging, if you will, the new biomechanics in that person's spine. And when you do that a few times repetitively, and I talk about a few times, we only see most of our patients for 1 to 3 visits and get them out of pain and then let the patients come in when they feel like they need a tune-up. It is not necessary to be going to somebody 3 times a week for months on end, and then 2 times a week for months on end, and then 1 time a week for the rest of your life kind of thing. That's just not reality. I mean, patients complain about the time that they spend in other chiropractors' offices. We have patients in here, you saw some yesterday, that had been going 3 times a week for months and they weren't any better. And, you know, I tell all my new patients that come here, if you're not feeling the difference in my adjustments in the first 3 days, I'm not even going to continue seeing you. Because you're going to know pretty quickly whether it's effective or not, wouldn't you say?
Certainly, yep.
So anyway, we're going to adjust Dr. West this morning. I'm going to check your posture first, though.
All right.
Let's have you flex your head forward and backwards for me, please, Wes. Neutral. Not bad. Not bad. You just got a little bit of the forward stuff today.
Okay.
Okay, let's lay you on your back, and we're going to do this ring ringer on you this morning. And slide down just about half an hour right there. Good. Let your legs relax. This adjustment is very specific for decompressing the entire spine from the occiput all the way down to the sacrum in one split second adjustment. He's a little longer legged, so I'm gonna lift his legs up a little bit more. There we go. Yes, sir. Okay. Don't bite your tongue. Nice deep breath through your nose. And you bring it to tension, and then you hit it. You don't wiggle it around side to side like all these Y-strap guys are doing. You just get it to tension, and then you hit it. And that's all I'm going to do on him this morning, because we're going to adjust each other that way today. In fact, in this same video, he's going to adjust me.
Oh, good.
I love it when these guys come in and get trained, because I get 2 ring dingers a day myself. There we go.
What's your...
All right. Did you feel that all the way down?
Oh, yeah, big time. Flex forward and back. Okay.
Well, it's better today than it was yesterday, huh?
Yeah, a little bit.
I'm still translated right.
And a little bit, yeah. Is that your normal pattern?
Yeah, it is.
Okay.
Let's keep dancing.
Yeah, just a little bit.
Okay.
A little bit more.
Okay.
There we go.
See, he's a quick study. He's getting my legs up before he puts both pins in.
Yes, sir.
Good job.
One thing I will say that I don't know that I've observed as much through the videos that I think is important is the home exercises that the patients that we need to do ourselves
Yes.
to be an extension. I think it's really important to do.
The homework.
Yes, sir. To ingrain what we have reset
Yep.
in these adjustments. All right, sir. Deep breath.
Oh, good job. See, you laid into that one more today.
Yes, sir.
That was perfect. How do you spell relief? Ring digger. And look at there, I'm still kicking.
Still kicking. Excuse me.
Yep. No problem. Okay. Thank you. All right, so both of us have gotten our morning ring dingers here at Advanced Chiropractic Relief in Houston, Texas, and we're going to continue all day long with patients and doing their histories, examinations, and adjusting them. And Dr. West is going to get to observe all that firsthand and see real patients with real problems that are coming to our office from everywhere. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas with
your South Carolina chiropractor, Dr. Wesley Richardson.
Yes, and he is the newest member of Team Ring Dinger, and we welcome him to the team. We'll see y'all soon.